Hi, Kevin Henry here today in Anchorage, Alaska, talking to Dr. Mary Williard. She's the Dental Health Aide Therapist Education Director for the Alaska Native Tribal Health Consortium. We got through that.
It's a mouthful.
That is. Well, first of all, thank you for letting us be here today. I appreciate it.
Thanks for coming.
There's a lot of misinformation, I think, out there about dental therapists and DHATs. Talk a little bit about this program and what DHATs or dental health aides are trained to do.
So we have a 2-year post-high school training program, and what we teach is a holistic approach to dentistry and also a evidence-based approach. So we give them a lot of information about prevention and community prevention projects for dentistry. And they also learn to do some basic dental procedures that will be really necessary to be able to provide for the patients in their villages as well. One of the things that has happened with our program is that the area that gets the most attention is the fact that they do quote-unquote irreversible procedures.
Yes.
And for me and our students, that's really probably the least important thing that we're doing in our villages. We really want to be an advocate for oral health and being able to put down the handpieces, put down the forceps, and teach and support health. But we recognize that there is a huge need for services, a backlog of decay out there that hasn't been treated for years. And so they also need those skills as well. But the best part of this program, why I'm here, is because I see this is going to turn that tide of the decay that's been so rampant in many of our communities, and that we haven't been able to address appropriately by having part-time people going in and out of the villages. So.
You were telling me earlier that you've actually been to a lot of villages and that you've seen some of the fear maybe that is there amongst the people. Talk a little bit about fighting that fear and these people coming in to teach oral health and try to reverse that trend.
Yeah, so I have been a dentist out in the southwest area of Alaska, and there's about 48 different villages out there, and I've been to quite a few of them. But as a dentist, I was stationed in the Hubs community, the largest community in that area called Bethel. And when I went to do village care, I would fly in for a week or 2 at a time, and that may be all the care that village gets in the year. And so when I was there, during the day I would see the school kids, and then in the evenings I would try and take care of as many toothaches as I could. I didn't have time to sit down and talk to people and figure out, what the best way is for that individual to go about changing things in their life, habits and patterns, so that their oral health will be better, So after year after year after year, I would be going out there doing really great dentistry, because I'm pretty good, right?
Of course.
I'm doing the best I can, for sure, and I'm pretty proud of the work I do. But what I noticed is that, I could take care of all the cavities in a child's teeth in one visit, come back the next year, but there's more there again. So I really haven't done much. I've kept myself busy,
Sure.
but I haven't actually prevented anything from happening. I haven't increased the health of that child. And so this program is going to answer that question of how do we do different? How do we actually increase the health of the population? And the other benefit that we get to provide is we have the ability to be there, provide care consistently, and in a much more gentle and patient-centered way than what I was able to do as an itinerant, basically, coming into the village for a short amount of time, doing as much as I could and getting out of there. I had times when I would have a small patient in the chair who, it was their first visit, and I had to, perhaps strap them in a papoose board because they were too young to cooperate and take those teeth out, their 4 front teeth all at once, because they were rotten and infected, and we didn't have options. We couldn't sedate they needed care. But that's a really traumatic first experience.
Sure.
And so what we created was a culture of dental fear. Having a therapist in the community, living and working there, being able to see the patients on a regular basis, being able to bring patients in and not do those invasive things right off the bat. Our hope is that we'll get rid of that fear of dentistry. And then when we have no more fear, we're going to have the ability to actually work with the patients and be partners in their health.
Let's talk about a couple of misconceptions that are out there. Number one, dental therapists cannot do everything that a dentist can do, correct?
No.
Tell what the dental therapists can do.
Dental therapists have a very limited scope of practice. So they can do basic prevention services and like fluorides and sealants. They can do the cleanings, remove calculus above the gums, and they can do some simple basic restorative like amalgams and composites. They will also do some simple extractions, but they don't do things like crowns and bridges and dentures and root canals, all of those things that I went to dental school for 4 years, so I could learn that entire scope. And that's why it took me so long to go through school. It wasn't just that I had trouble learning. But with our therapists, we don't need them to learn that whole scope, and so we can really shorten the time that they have to spend with us.
And I think another misconception is that these therapists are out there working all by themselves.
At the point where they are able to be certified, they can work in general supervision, where they may not be in the same building as the dentist, but that doesn't mean that they are out there doing whatever they want without any oversight. That is not at all what they're doing. What they have is they have a supervising dentist, and most of them will check in daily with that supervising dentist. And if there's procedures that are out of their scope, those are then referred in. So it's a great benefit, because the patients that have just basic service needs and are healthy, great. Let's treat those out in the village. They don't have to come in and spend the money to see a dentist. But if they need a dentist, they can get into the dentist now.
Talk a little bit about the relationship between the tribes and the dental therapists that are coming in, because you told me earlier that they actually have to be sponsored before they even start here at the training.
Right.
Talk a little bit about that relationship.
Well, all of our students right now have a sponsorship, educational loan agreement, basically, with their tribal sponsoring organization. And so they've agreed to allow the tribe to support them through the training, and then they owe 4 years of service back to that tribe. They get their salary, but they do have to be there and provide that care, so the tribe gets the benefit of having a guaranteed provider, and our students all have a guaranteed job.
What are some of the main points that you want our viewers to know about the dental therapists and about your program here?
Well, one thing is that this is something that has been utilized in almost 50, or actually more than 50 countries in the world. So it's not something new. It's just new to the U.S. And there's lots of information out there about safety and effectiveness of dental therapists. I've supervised dental therapists, and I wouldn't put my license on the line for somebody that wasn't qualified. That's my bread and butter. I've got kids at home I got to feed. So it's serious stuff, and I take it seriously. And what I've seen from working with the therapists in the villages, from doing the education program, is they're very capable to do the procedures that are within their scope of practice, and they stay within that scope. We don't have issues with therapists trying to work outside their scope. It just doesn't happen. From the day they come into our training, they learn they're in a limited scope, and that they're supervised. And so they're trained to work within that. The other thing that I think is important to know is that this program grew out of local needs and local desires to do something to improve the oral health of the communities, because so many people were having issues with getting the care they needed in a timely manner. And so it's a local solution to a local problem. And it makes a lot of sense here, but it also has a national implication, because one of the things I keep thinking is, if we can do this sort of thing here in Alaska with all of the barriers we have and the challenges we have to, the geography and the extra cost, if we can do it here, it can be done anywhere.
Last point I'd like you to make, we spoke earlier about the size of Alaska, and there was a part of this that was the size of the state of Oregon.
Mm-hmm.
Give us some of the statistics about the people that are there and the amount of providers that are there.
Well, that's the area that I used to work in, is the southwest part of the state. It's the Yukon-Kuskokwim Delta region. Those are two of the rivers that run through there. And the Yukon-Kuskokwim Health Corporation, it's hard for me to say after all those years, that health corporation oversees clinics in the area the size of the state of Oregon. So there's 48 different clinics throughout that size area, and 30,000 people or so that live there. So, and most of the places there's no roads in between them. You get there by flying into them, or sometimes in the summer you can take a boat on the river, or in the winter you can take your snow machine, So people who can work in these smaller communities and make it economically feasible. Having me as a dentist stationed in a community of 300 doesn't make sense. Having a DHAT who makes a lower salary than a dentist, that makes better sense, and allows for that dentist's reach to actually extend into those smaller communities.
It's been a really educational, informative time, so thank you so much for having me here. I appreciate it.
Yeah, you're welcome. Thank you. It's a
Thanks.
pleasure.